Hello. Today we're going to talk about anxiety disorders and obsessive compulsive disorder. Starting with chapter 4, the chapter we're in right now, we get into the best part of the course because now we get to start learning about all of the psychological disorders that we will be studying. For each of the disorders that you learn about, I would like to encourage you to really pay attention to what is known about causes and treatments of the various disorders, and of course also appreciating the symptoms that need to be present before a particular diagnosis can be made. I'd like to talk about two different related perspectives to help us think about disorders. One is the biopsychosocial approach that we've already learned about to remind us that every disorder has a multiple combination of factors that come together and interact to produce that disorder. Disorders are never due to just one thing. So we'll be appreciating the influence of biological, psychological, and sociocultural factors as we explore different disorders. Another idea I'd like to discuss just briefly is what's called the diathesis stress model as it relates to psychological disorders. You may be aware already that the diathesis stress model takes a look at how we first need to have a predisposition towards developing a disorder before it would be possible for that disorder to become manifested in us. That predisposition oftentimes is genetic, but it could also be environmental, say an early loss or trauma that might continue to affect someone in the future and make them more susceptible to developing a disorder. You will also come to appreciate, as you read about the different disorders, that there's difference of opinion about many things having to do with the diagnosis, etiology or cause, and treatment of psychological disorders. Researchers are learning new things every day, and hopefully clinicians can practice in a way that allows them to be informed by research so that they can be even more effective in their work with their clients. So let's talk about the anxiety disorders a little bit. So in chapter 4, anxiety disorders that are covered include generalized anxiety disorder, social anxiety disorder, panic disorder, phobias, and obsessive compulsive disorder. So I'd like to touch on a few highlights with these disorders as we're getting into our discussion about the anxiety disorders and obsessive compulsive disorder. Are you familiar with that character in folk literature, Chicken Little? He runs around saying, "The sky is falling, the sky is falling." He imagines that something awful or terrible is going to happen, but he doesn't know quite what it is. And this is the way it is with people with generalized anxiety disorder. They often have this sense of what's called impending doom, that something awful or terrible is going to occur. and they have many worries about little things. And the object of their worries can change from moment to moment. They also may experience what some people call free floating anxiety, where there's just this diffuse kind of anxious cloud that hangs over them. Now, most of us probably haven't experienced generalized anxiety disorder, but everybody gets anxious at one time or another. We know what it's like to feel nervous, to even feel afraid. We know what it's like to be tense, to worry about things. So, in generalized anxiety disorder, these kinds of experiences are more pronounced and cause distress and dysfunction for the person. Fortunately, there are treatments available for generalized anxiety disorder, both biological and psychological. Interestingly, the neurotransmitter GABA has been found to be in undersupply in individuals with generalized anxiety disorder. So, when they take anti anxiety medication, say like Xanax, that medication binds directly with the GABA receptor sites of GABA neurons in their brain, and it has a calming, relaxing effect on the person's nervous system, and it helps them to feel less anxious. It's interesting to consider how the treatment of generalized anxiety disorder has evolved. Probably the most helpful approach with that disorder is one referred to as cognitive or cognitive behavioral. And as you know, the cognitive approach focuses on the way we think, and the behavioral approach more on our observable behavior and how we learn through conditioning. Probably the most fruitful way of thinking about the treatment of generalized anxiety disorder from a psychological perspective is to think about how you might address the distorted thinking that someone with this disorder might experience. People with generalized anxiety disorder tend to engage in a lot of what if thinking, and we do this too. Like we imagine, well, what if one thing happens, and then what if another thing happens, and then what if another thing happens, and then what if yet another thing happens? And we can blow things way out of proportion and make ourselves feel very anxious and become quite worried. Fortunately, these worst possible outcomes that we imagine don't come to pass, but we do think in that way sometimes, and people with generalized anxiety disorder tend to think like that a lot. So cognitive therapy for that disorder in the earlier days focused more on directly addressing the distorted thinking and helping the person to work on changing it, pointing out how it's illogical or irrational and the consequences of thinking that way, helping the person to test out their thoughts to see if they really are consistent with reality or not, to help them modify their thoughts. And that approach has been found to be helpful. But a newer way of approaching the treatment of generalized anxiety disorder is what some people refer to as new wave cognitive therapy, simply meaning it's a more modern approach to helping people with generalized anxiety disorder and other anxiety problems from a cognitive approach. I really find this approach quite appealing, and it's one that I try to use in my life personally in dealing with both thoughts and feelings. And it relates to more of an Eastern philosophical understanding of human nature and how our mind works, called mindfulness. There is a discussion about mindfulness in your chapter. I hope you'll read it and think about it, and possibly even find sources that would allow you to learn about and practice mindfulness in your daily living. One individual who's done a lot of work on mindfulness is John Kabat-Zinn, and he has some great mindfulness meditations on YouTube that you might consider using. I like to combine mindfulness with prayer as a meditative technique that I find very helpful. Well, getting back to anxiety disorders, specifically generalized anxiety disorder, this new wave cognitive approach helps the person to learn how to be a better observer of what's going on in their mind. In a sense, you step back and you just pay attention to what's going on in your mind, to your thoughts, to your feelings, to memories that might emerge. And you appreciate how whatever's happening in your mind right now is only temporary. You can think of it like clouds in the sky. Clouds pass by. They don't stay formed for very long. They're constantly changing. The same is true for activities that go on in our mind, according to this approach. So let's say, for example, that someone with generalized anxiety disorder worries a lot. The therapist might help them to become a better observer of their worry and to come to appreciate that their worry is temporary. It eventually passes, as do uncomfortable feelings that might be associated with their worry. And they might also help the person to try to take a look at, well, what function does your worry serve for you? How might it be helping you? And are there other ways you could help yourself even more than worrying? Let's say, for example, that you were taking a course and you made a poor grade on a test, and you're worried that you might do that again. And as a result, it's on your mind a lot, and you find yourself studying more so that you'll be better prepared for the next test. If that's the function that your worry is serving you, it's actually helping you to become better prepared for the test. But if your worry is so extreme that you can't focus, you can't concentrate, you can't sleep at night, when you take the test, you freeze up, you can't remember what you actually know, then the worry is working against you. So exploring worry from that sort of mindfulness perspective is a way that cognitive therapists nowadays might approach generalized anxiety disorder as well as other anxiety problems that people might have. Social anxiety disorder is an interesting disorder to consider from a multicultural perspective. With social anxiety disorder, as you're probably aware, people are concerned about what others are going to think of them when the person is the center of attention. One common way in which it manifests itself is in public speaking. The individual is concerned when they're in front of an audience that they may make a mistake, that other people may criticize them or laugh at them. Some other situations where social anxiety disorder may manifest itself are eating in public restaurants and also using restrooms publicly, especially for men, where urinals are involved. I said that this disorder is interesting to think about from a multicultural perspective because it manifests itself differently in Western cultures versus Eastern cultures. By Western cultures, I mean cultures like the United States, and Eastern cultures, more Asian type cultures, say like in Japan. So in Western culture, which is more individualistic, we tend to focus on ourselves, on what other people are going to think about us. Whereas in Eastern culture, our focus is more on the other person. Those cultures are collectivist, and that means the focus is more on the group and what's good for the group. So in Japan, social anxiety disorder manifests itself in a different way. Over there, people who develop this disorder, they're not so much concerned about what they are going to look like, that other people are going to criticize them or laugh at them, but rather they're concerned that they may somehow offend the other person. Maybe they make eye contact at the wrong time or give off a body odor or something like that. So we can see with this particular disorder, the way it's manifested varies based on the culture in which the person lives, but the distress and the dysfunction would be pretty similar. I think that's a really fascinating aspect of that particular disorder. So let's talk about panic disorder a little bit. If you've ever had a panic attack, you know how frightening that is. Our heart beats fast, our breathing rate quickens, it's hard for us to get our breath. We may feel like we're choking. We may feel numbness or tingling in different parts of our body. We may feel afraid we're having a heart attack or we're losing our mind. Terrifying, having a panic attack. And if you've ever had one, you know exactly what I'm talking about. So if we want to think about this on a biological level, of course, there's a activation of the autonomic nervous system, like in the fight or flight response when somebody has a panic attack. Now, if you've had a panic attack now and again, it doesn't necessarily mean that you have panic disorder. But when someone has had at least one panic attack and they become concerned that they may have more panic attacks to where it causes them distress and they start changing the way they live by avoiding certain situations that they are afraid they could easily get out of if they started feeling panicky, then the person may actually be experiencing panic disorder. I read of a woman once with panic disorder who hadn't left her home in 20 years. Now that's a good example of how a disorder can not only cause a lot of distress, but also dysfunction in a person's life. So the author of our primary text, Comer, tells us about how some research has looked at the possible role of norepinephrine, a neurotransmitter, in panic disorder where it may become dysregulated, and how not only might anti-anxiety medication help, but also antidepressant medication may help in regulating panic attacks on a biological level. And in fact, both of those medicines are used to treat it. But psychological approaches, mainly cognitive behavioral, have also been found to be very helpful in helping individuals to better interpret sensations within their body, because they do tend to overinterpret their bodily sensations and overreact to them, to learn how to identify when a panic attack is starting to come on, and then to use a combination of relaxation and cognitive restructuring techniques to help themselves to get through panic attacks better, but also to hopefully learn how to prevent them from occurring at least as much as they have been. So panic disorders are very treatable and quite rewarding to treat. In the past, we've considered how diagnosis can sometimes be advantageous and sometimes disadvantageous to individuals in how it may affect the way they feel about themselves. The idea of social labeling and how it can be detrimental. But the correct diagnosis of panic disorder could actually give somebody a great sense of relief. Imagine someone who has recurrent panic attacks and they keep going to the emergency room, afraid that they're having a heart attack. And they keep evaluating them and telling them that there's nothing wrong with their heart and sending them home, yet the attacks persist. And then finally, they go in one night and their panic disorder is correctly diagnosed. And they're told, this is panic disorder. It's highly treatable, and we believe we can help you with it. We're going to refer you to someone to help you get started. And that would be a great relief to me to know that there's a name for it. Other people would go through this too, and help is available, and it could help me to feel hopeful that I could get to a better place. Let's talk a little bit about phobias. We all have things that we have some fears about. It's just a natural reaction for us to have. But in the case of phobias, the fears are much more extreme. And with phobias, individuals may be afraid of objects or situations. An object could be an example of that, might be snakes. A situation might be, say, bad weather or flying on a plane, something like that. There are many different phobias that are possible. Just look them up on Google. It's amazing how long the list is. And they each have Latin names that are fun to take a look at, and all the different varieties of names that are used for the many different phobias that a person might experience. But it's not fun having a phobia. It's very distressing. To help us appreciate how distressing phobias are, I provided you with a fascinating video to watch of a young woman with a snake phobia that's treated very effectively with exposure therapy. So I hope you enjoy that video. There are various ways in which phobias can develop, but one is through some sort of classical conditioning experience. And the treatment methods that are used to help people with phobias are in large part based on principles of learning, especially classical conditioning, but also observational learning and even operant conditioning too. We could look at how it might come into play in the treatment of phobias. Let's say, for example, that you have a bad experience flying on a plane, and after that, you're afraid to fly before you were done. So if you were to go see someone for a treatment for your fear of flying, if it were so extreme that it caused you distress or interfered with your functioning, so you needed to be able to visit your family and they live on the other side of the country and you need to be able to fly to get there, the treatment would be geared to help, to use a learning term, extinguish the fear response that you now associate with airplanes after having a bad experience of being on an airplane. So there's a good discussion about exposure therapies in the chapter. I'll refer you to that. And when you see the video, I hope you'll I'd like to ask you to think about what psychological principles help to explain the treatment that's going on in that video. And the treating therapist actually goes into an explanation of that in the video as well. Finally, I'd like to say a few words about obsessive compulsive disorder. In DSM-4, obsessive compulsive disorder was categorized as an anxiety disorder, but in DSM-5, they sort of gave it its own category, obsessive compulsive and related disorders. So, as you know, obsessive compulsive disorder is one where an individual has obsessions, which are recurrent thoughts that cause them to feel a lot of anxiety. And then they have compulsions, which are repetitive behaviors in which they engage in an effort to relieve the anxiety. A good example of this would be someone who worries about germ contamination. They're afraid of getting germs on their hands, so they end up washing their hands many times a day. Obsessive compulsive patterns can take many different forms, where people will engage in compulsive rituals to try to relieve the anxiety that results from their obsessive thinking. One of the more interesting cases I ever knew about was a woman who had this obsessive compulsive pattern of having to go back and retrace her route when she drove to work in the morning, to go back and recircle and retake the path she had just taken because of her concern that she may have run over someone and killed them. So it took her a very long time to get to work. So interestingly, on a biological level, one of the findings has been that people with OCD tend to have an undersupply of serotonin. So one of the treatments biologically is to give them antidepressant medication to help increase serotonin activity in their brain to help regulate their brain more effectively. And the part of our brain, the thinking part of our brain in the frontal lobe area, has been found to be overly active in individuals with OCD. Uh, so medication as well as psychological treatment helps to sort of quiet that area so the person is not so obsessive about the issue, whatever it happens to be, that leads to their compulsive rituals. I've provided you with a two-part video uh, on a young woman with obsessive compulsive disorder. It's a fascinating look at the disorder and also the use of ERP, or exposure and response prevention therapy, in the treatment of obsessive compulsive disorder. And as you watch that video, I hope you'll think about the psychological principles that that particular treatment approach is based on. Well, that's about it for now. I look forward to talking with you again soon.